we are living in the clinic a new era, and this is the era of immunotherapy. The pioneering drug was helping 15% of my patients. This question started bothering me. Why is it only helping 15% of my patients? And what's wrong with the drug at the other 85% for whom it's a hope shattered?
And then we discovered the patients that were immunosuppressed based on our blood test did not respond to the therapy. And we suggest that if we will monitor the immune system of the patient, we can increase patient numbers that will respond to this immune-based therapy.
When you start activating the immune system of a patient, and in 2 weeks, the patient comes to the clinic and says, I don't need painkillers anymore. This is something that it is worth being a doctor for a long time just to live there to see this.
The major obstacle in IVF is implantation of the embryo. This today, I would say, is the largest obstacle for becoming pregnant.
In a regular situation where we have an implantation, we have the retraction of the endometrial cells, making space for the invading embryo. Patients who fail to have pregnancies, this process is not working. The cells do not retract and the embryo does not attach. And if we correct the expression of this adhesion molecule, we can see that we restore the ability of the embryo to adhere and to start the invasion process into the system.
If we have the possibility in the future to differentiate the correct cycle, this is a dream come true.
And hopefully we'll have a solution for those women who cannot conceive today.
Asthma is a very, very prevalent problem in Israel and in most Western countries. You see patients all the time in clinics, in the hospital, with shortness of breath, with cough, who suffer from asthma. Patients with severe asthma may even die of their disease.
We found something we think is a main component of the pathophysiology of the disease, and therefore by targeting it, we should be able to treat better patients.
This molecule, this particular molecule that we're working on now, seems to be very, very promising, and I think that the way to take it forward is this collaboration between clinical and basic science, which will allows us to take things forward.
Idea behind the Hebrew University Medical School was that on the same campus we have the clinical side and we have the research side, which deals with the most advanced technique.
And this close relationship between somebody who is a basic scientist who works in pharmacology together with somebody who is clinical and works with patients, and that is the key to successful collaboration.
And this crosstalk between us, we constantly have, but I think this and I think that.
We understand our languages.
And all this is done very, very naturally because we are on the same site.
And it is very fertilizing, this kind of discussion between us. So who knows what's going to be in the future? We are excited about that, for sure.
I'm also very excited.